Let me ask you something that most men never hear until it is too late. What if you could wake up tomorrow and feel no urgency, no pressure, no struggling to empty your bladder, no interruptions at 2 in the morning? What if the second half of your life didn't have to come with discomfort or prostate problems? I'm Dr. Sarah, a health educator with over 20 years of experience helping men navigate their health after 60. I want to share some vital information with you that could completely change your approach to prostate health. Subscribe now, because what I'm about to explain is something that often gets overlooked in standard medical advice. The quiet truth is, most prostate issues don't start because your body gave up. They start because no one ever taught you how to properly care for it. In the next few minutes, I'll reveal 3 simple, natural daily habits that can help protect your prostate, reduce swelling, and improve urine flow without expensive pills or uncomfortable procedures. What you'll learn could transform your comfort, your confidence, and your sleep. Stick with me. Now, let me share exactly what I've learned through 2 decades of working with men and their doctors to address these very concerns. The 3 habits I'm about to reveal aren't complicated medical procedures or expensive supplements. They're simple, daily choices that work with your body's natural wisdom, not against it. Let me start with Robert's story. He's 68, a retired electrician who'd been married to Helen for 42 years. Robert came to me already working well with his urologist. What he wanted was to understand if there were natural approaches that could support his comfort alongside his medical care. I coordinated with his medical team, and together we focused on 3 specific areas that research shows can make a remarkable difference. Within 6 weeks, Robert noticed he was sleeping through the night more often. His doctor was pleased with his progress during routine checkups. Today, Robert continues both his medical care and these natural approaches, feeling more confident and comfortable than he had in years. The first habit that made such a difference for Robert involves something you do every day but probably never thought about in relation to your prostate: how and when you drink water. I know this might sound too simple, but stay with me because the science behind this is fascinating. Your prostate sits right beneath your bladder, and as we age, this walnut-sized gland naturally changes. Think of your urinary system like a well-designed plumbing network. When we're younger, everything flows smoothly and efficiently, but after 60, several things happen that are completely normal parts of aging. Your kidneys become slightly less efficient at concentrating urine, and your bladder becomes more sensitive to irritation. Here's what happens when you don't drink water strategically. During the day, if you're not getting enough fluids, your urine becomes concentrated and acidic. This concentrated urine acts like a mild irritant, not just to your bladder, but to your prostate as well. Your body responds to this irritation with mild inflammation, which can make you feel like you need to urinate more urgently and more frequently. Research from a clinical trial published on clinicaltrials.gov followed men over 50 and made a remarkable discovery. When men adjusted their water intake timing, spreading it evenly throughout the day and reducing it in the evening, they experienced nearly a 42% reduction in nighttime awakenings for urination. That's the difference between waking up 3 times a night versus once or twice. The key isn't drinking more water overall, it's drinking smarter. Here's exactly what worked for Robert and many others I've guided through this approach. First, start your day with warm water. Not cold, not hot, but comfortably warm. This gentle awakening helps your kidneys begin their daily work without shocking your system. I suggest keeping a glass by your bedside and drinking it slowly when you first wake up. Second, sip consistently throughout the morning and afternoon. Instead of gulping large amounts at once, take small sips regularly. Your body can process and use water much more efficiently this way, and it prevents that concentrated urine situation I mentioned earlier. Third, and this is crucial, begin reducing your water intake after 6 or 7 in the evening. This doesn't mean stopping completely, but significantly cutting back. Your kidneys need time to process the day's fluids before you lie down for sleep. One important note for those with heart conditions or kidney disease: these fluid adjustments should always be discussed with your doctor first. Your medical team knows your specific situation and can guide you on the optimal amount of fluid for your health. I'd love to hear about your experience with water timing. Have you found approaches that work well alongside your medical care? Share your story in the comments. The second habit that can transform your comfort involves gentle movement that most men never consider. Many men spend significant portions of their day sitting, reading, watching television, working at computers, or driving. This sedentary time creates what I call stagnation in your pelvic region. Imagine your prostate like a sponge that never gets gently squeezed. Without regular movement and circulation, fluid can pool in this area, contributing to inflammation and discomfort. A comprehensive analysis published in Neurology and Urodynamics examined the effects of simple pelvic floor exercises on men aged 55 to 80. The results were encouraging. Participants experienced a 22% reduction in nighttime urination and significant improvement in their overall symptoms. These weren't complicated exercises requiring special equipment or gym memberships. The movement approach I share with patients like Robert involves 3 simple activities that enhance circulation to your pelvic region. First, take short walks after meals. This doesn't need to be vigorous exercise. A gentle 5-to-minute walk helps activate the muscles in your pelvis and encourages healthy blood flow to the area. Second, perform gentle hip rotations several times throughout the day. Stand with your feet shoulder-width apart and slowly rotate your hips in small circles, first clockwise, then counterclockwise. Do this for about 30 seconds in each direction. This simple movement helps maintain flexibility and circulation in your pelvic region. Third, activate your pelvic floor muscles regularly. These are the muscles you use to stop urination midstream. Gently contract these muscles, hold for 3 seconds, then release. Repeat this 10 times, 3 times throughout the day. Think of it as giving your prostate a gentle, supportive squeeze that encourages healthy circulation. Research also suggests that foods rich in compounds called polyphenols can support healthy circulation throughout your body, including the pelvic region. A 2024 study found that pomegranate, which is rich in these beneficial compounds, may help improve blood flow and reduce inflammatory markers. While this research is still developing, many of my patients enjoy adding natural sources of these compounds to their diets. This movement approach is very safe for most men, but proper technique is important initially. If you have chronic pelvic pain syndrome, discuss these exercises with your doctor first. For pomegranate or similar supplements, be aware of potential interactions with blood-thinning medications. The third habit addresses something that might surprise you: the connection between your digestive health and your prostate comfort. This relationship is more direct than most people realize. Your rectum sits directly behind your prostate. When waste material becomes hard and difficult to pass, what we call constipation, it creates mechanical pressure directly against your prostate from behind. This pressure can contribute to inflammation and discomfort, making you feel like you need to urinate more frequently or urgently. Think of this like having a neighbor who occasionally leans against your fence. A little pressure now and then isn't problematic, but constant pressure becomes uncomfortable and can cause damage over time. That's what happens when constipation becomes chronic. A study published in the American Journal of Clinical Nutrition followed over 0 adults aged 60 and older and found that those with fiber-rich diets had a 52% lower risk of chronic constipation. This reduction in constipation directly translates to less pressure on the prostate and greater comfort. The fiber approach I recommend focuses on gentle, natural sources that are easy for your digestive system to handle. Warm oatmeal is excellent because it provides soluble fiber that helps soften waste material. Chia seeds, when soaked in water for 10 minutes before eating, create a gel-like consistency that aids smooth digestion. Steamed vegetables like broccoli, carrots, and squash provide fiber, along with important nutrients. Fruits with their skin intact, such as pears and apples, offer both soluble and insoluble fiber that supports healthy elimination. The key is adding fiber gradually to allow your digestive system time to adjust. Start by adding one high-fiber food to your daily routine and increase slowly over several weeks. This prevents the bloating or gas that can occur when fiber is increased too quickly. Remember to maintain adequate water intake when increasing fiber. Fiber works by absorbing water and creating bulk that moves smoothly through your system. Without sufficient fluid, fiber can actually worsen constipation. Those with a history of bowel obstruction should consult their physician before making significant dietary changes. Your doctor can guide you on the appropriate amount and type of fiber for your individual situation. What questions would you ask your doctor about adding natural approaches to your routine? Comment below your questions. Help me create better content for our community. Now, here's where the real power lies. Combining all three approaches. The wonderful thing about working with your body's natural systems is that these habits support each other. A systematic review published in BJU International examined exactly this combination approach. Researchers found that when men implemented proper hydration timing, gentle pelvic movement, and adequate fiber intake together, the benefits exceeded what any single approach could provide. The study showed nighttime urination could decrease by up to 35%, and sleep disruption was reduced by 1/3. Let me share how this worked for Frank, a 71-year-old retired teacher I worked with alongside his medical team. Frank had been managing his prostate health well with his doctor's guidance, but he wanted to explore additional supportive approaches. We started slowly, adding one habit per week. First, we adjusted his water timing. Frank noticed within days that he felt less urgent during the day. The second week, we added the gentle movement routine. By week 3, when we incorporated more fiber-rich foods, Frank was amazed at how much better he felt overall. At his next medical appointment, Frank's doctor was pleased to see improvements in his symptom scores and overall comfort level. Frank told me later that he felt like he had tools to actively support his health rather than just waiting for problems to develop. The reason this comprehensive approach works so well is that it addresses the root causes of discomfort rather than just managing symptoms. Proper hydration reduces irritation, gentle movement enhances circulation, and adequate fiber prevents mechanical pressure. Together, they create an environment where your prostate can function more comfortably. Your body is remarkably wise and adaptive. Even after 60, it's constantly working to maintain balance and health. These 3 simple habits work with your body's natural healing ability, not against it. You're not fighting aging, you're supporting your body through this natural life stage. I want to emphasize that these approaches are designed to complement, not replace, your medical care. The most successful outcomes I've witnessed happen when men work closely with their healthcare providers while implementing these supportive lifestyle approaches. Charles, a 66-year-old former postal worker, exemplifies this partnership approach perfectly. When Charles first came to see me, he was already working with an excellent urologist who was managing his care very well. Charles simply wanted to understand what he could do personally to support his health. I coordinated with Charles's medical team to ensure our approach complemented his existing treatment. His doctor was supportive of the lifestyle modifications we discussed, especially since they were evidence-based and posed no risk to his current treatment plan. 6 months later, Charles reported sleeping better, feeling more comfortable during the day, and having greater confidence in social situations. His doctor noted improvement in his clinical assessments as well. Charles continues to see his urologist regularly while maintaining these healthy habits, feeling empowered and proactive about his health. This collaborative approach represents the future of healthcare for men over 60. It's not about choosing between medical care and natural approaches. It's about combining the best of both worlds, the expertise and monitoring of medical professionals with the power of evidence-based lifestyle modifications. Your doctor brings years of medical training and experience to your care. They understand your individual health picture, your medications, and your specific risk factors. This expertise is invaluable and irreplaceable. What you bring to this partnership is commitment to daily choices that support your health. You have the power to influence how you feel through simple, consistent actions. When medical expertise meets personal commitment, remarkable improvements become possible. Many men tell me they feel helpless about aging and prostate changes. They assume discomfort is inevitable and that they have no control over their situation. This simply isn't true. While we can't stop aging, we can absolutely influence how comfortable and confident we feel as we age. These 3 habits, strategic hydration, gentle movement, and digestive support, represent areas where you have complete control. No one can make these choices for you, and no medication can replace the benefits of consistent, healthy daily habits. The research I've shared with you today represents thousands of participants and years of scientific investigation. This isn't wishful thinking or unproven theories. These are evidence-based approaches that have been tested and validated in clinical settings. More importantly, I've witnessed these benefits personally in my practice. I've worked with hundreds of men who have implemented these approaches alongside their medical care, and the improvements in their quality of life have been both measurable and meaningful. Sleep quality improves when nighttime disruptions decrease. Confidence grows when urgency becomes less frequent. Social activities become more enjoyable when bathroom concerns diminish. Energy increases when sleep is more restful. These aren't just physical improvements, they affect every aspect of life satisfaction. I also want to address the concern some men have about the time and effort required for these changes. Robert, Frank, and Charles didn't transform their entire lives overnight. They made small, gradual adjustments that became natural parts of their daily routines. The water timing adjustment takes no additional time, you're simply spreading out something you already do. The gentle movements can be incorporated into activities you already perform, like walking to get the mail or standing up from your chair. The dietary changes involve choosing different foods, not necessarily eating more or preparing complicated meals. Within several weeks, these habits become automatic. You don't have to think about them or force yourself to remember them. They become as natural as brushing your teeth or putting on your shoes. The key is starting with one habit and allowing it to become comfortable before adding the next. This patient, gradual approach prevents overwhelm and increases the likelihood of long-term success. Some men worry about whether these approaches will be effective for their specific situation. Every man's body is unique, and individual responses can vary. However, the principles behind these approaches, reducing irritation, improving circulation, and decreasing pressure, apply to all men. The severity of your current symptoms doesn't determine whether these approaches can help you. I've worked with men who had mild concerns and wanted to prevent problems, as well as men who were already experiencing significant discomfort. Both groups found benefit, though the timeline and degree of improvement varied. Your age doesn't limit the effectiveness of these approaches either. I've guided men in their 60s, 70s, and 80s through these modifications with positive results. Your body's ability to respond to healthy changes doesn't disappear at any particular age. Even if you've tried other approaches in the past without success, these habits offer a fresh perspective. They focus on supporting your body's natural functions rather than forcing changes or suppressing symptoms. The beauty of this approach is its sustainability. These aren't temporary measures or short-term fixes. They're lifestyle modifications that can support your comfort and confidence for years to come. As you implement these habits, you might notice other positive changes beyond prostate comfort. Better hydration often improves energy levels and mental clarity. Regular gentle movement can enhance overall mobility and strength. Improved digestive health often leads to better nutrient absorption and general well-being. These interconnected benefits reflect the wisdom of supporting your body as a complete system rather than focusing on isolated symptoms or individual organs. I encourage you to discuss these approaches with your healthcare provider at your next appointment. Most doctors appreciate when their patients take an active interest in supporting their health through evidence-based lifestyle modifications. You might say something like, "Doctor, I've been learning about the connection between hydration timing, gentle movement, and digestive health for prostate comfort. What are your thoughts on incorporating these approaches alongside my current care?" This type of conversation demonstrates your commitment to your health while respecting your doctor's expertise and maintaining open communication about your complete care plan. Remember, you're not asking for permission to drink water, move gently, or eat fiber-rich foods. You're sharing information about your lifestyle choices and seeking your doctor's perspective on how these approaches might complement your medical care. Most physicians welcome this type of collaborative relationship with their patients. They understand that the most successful health outcomes occur when medical treatment is supported by healthy lifestyle choices. In closing, let me summarize the 3 evidence-based habits that can support your prostate health and overall comfort. First, strategic hydration. Spreading your water intake throughout the day and reducing it in the evening to minimize nighttime disruptions while maintaining proper hydration for optimal urinary health. Second, gentle daily movement. Incorporating short walks, hip rotations, and pelvic floor activation to enhance circulation and reduce stagnation in your pelvic region. Third, digestive support through fiber, gradually increasing natural fiber sources to prevent constipation and reduce mechanical pressure on your prostate. These aren't complicated medical interventions or expensive treatments. They're simple, natural approaches that work with your body's wisdom to support comfort, confidence, and quality of life. The research supporting these approaches is solid and growing. The men I've worked with have experienced real, meaningful improvements in their daily comfort and nighttime rest. Most importantly, these approaches can be safely combined with any medical treatment you're currently receiving. You have more control over how you feel than you might realize. These daily choices represent areas where your decisions directly influence your comfort and well-being. You're not powerless against aging or prostate changes. You have tools, supported by science, that can help you feel better. If this evidence-based approach resonates with you, please subscribe for more practical wellness education that honors your relationship with your healthcare provider. Share this with someone who values both natural wellness and medical expertise. Together, we can help more men over 60 live with greater comfort, confidence, and vitality. Your journey toward better prostate health starts with a single choice to support your body's natural wisdom. Whether that's adjusting when you drink your morning water, taking a gentle walk after lunch, or adding some oatmeal to your breakfast, every positive choice moves you toward greater comfort and confidence. Your body has been serving you faithfully for decades. These 3 simple habits are ways to serve it in return, supporting its natural ability to heal, adapt, and maintain health throughout this remarkable stage of life.